Hi guys, so in this video we are going to discuss about congestive heart failure, mainly about the medications. So the medications that are usually used are ACA inhibitors, angiotensin converting enzyme inhibitors, and ARBs, angiotensin receptor blockers, beta blockers, calcium channel blockers, dilators, diuretics, and digoxin. So first of all, ACA inhibitors and ARBs. These medications mainly act on RAS system. What's RAS? RAS is the abbreviation for renin-angiotensin-aldosterone system. So by inhibiting this system, we are inhibiting the blood pressure. Because aldosterone is responsible for retaining sodium and water, and by blocking that process, we are excreting the sodium and water from the body, hence reducing blood pressure. So these medications are mainly will attribute in reducing blood pressure, but not the heart rate. Examples for ACA inhibitors are lisinopril, and for ARBs are valsartan. The main side effects for these group are they spare potassium levels, because they mainly, as I said before, they act on the aldosterone system. So they act on the potassium and sodium and potassium channels. So by excreting the sodium, we are retaining potassium. So this is the main side effects for both these groups. There are specific side effects which are accompanied with ACA inhibitors, like cough and angioedema. Both medications shouldn't be used in pregnancy, and it is not safe to be used in pediatric. The next group we have beta blockers. Beta blockers act mainly on the sympathetic nervous system. It blocks a specific hormone called adrenaline. By blocking that, we are reducing the blood pressure and heart rate as well. The example for this group is atenolol. Any medication which ends up with lol is mainly a beta blocker. The main side effects, as we said, because it affects the blood pressure and heart rate, is bradycardia and orthostatic hypotension. Actually, any medication from any group which reduces blood pressure, one of the main side effects is orthostatic hypotension. In this case, we have to advise the patient to not stand abruptly, or do not change positions abruptly. One of the main contraindications for beta blockers are acute heart failure, because it reduces blood pressure and heart rate. We cannot use it in case of acute. So mainly these medications that we are discussing are used for chronic heart failure, or what we call as a compensated heart failure, and contraindicated in asthma as well, because as we know, beta blockers or beta receptors are present on the lungs as well. So any when we block beta blockers, this will cause vasoconstrictions, which affects patients with asthma. Next group will be calcium channel blockers. These medications, they block calcium channels, and we know the action of calcium. Calcium is responsible for the contractions of the smooth muscles. So when we block calcium, this will lead to relaxation of the smooth muscles. By relaxation of the smooth muscles, we will reduce the heart rate. So we are mainly using these groups to affect the heart rate, not the blood pressure. Example of this medication of this group is difidipine, diltiazem, and verapamil. Dilators. Dilators, they act by dilating blood vessels, and by dilating blood vessels, we all know that we are dropping the blood pressure down. Examples of this medication are nitroglycerines, hydralazine, and isosorbide. And the same side effects for these medications, because it reduces blood pressure. We know that orthostatic hypotension is one of the side effects of this medication, And same as I mentioned before, one of the main advices that we have to give to the patient is to not stand abruptly. Diuretics, they act on the potassium and sodium channels. They act also on there are a group of medications which act on potassium and sodium channels, and other groups which acts on potassium and chloride channels. The medications like furosemide, these are examples of furosemide and thiazide. These are examples of potassium wasting diuretics, and spironolactone is called the potassium sparing diuretics. So mainly these medications, these group, what they do actually, they retain sodium, and by retaining they will retain potassium, and they get rid of sodium, and by getting rid of sodium, we are getting rid of water from the body, so we are dropping the blood pressure. These medications are usually advised to be taken in the morning because they are diuretics, so it is more convenient for the patient to take it in the morning. Digoxin, this medication mainly reduces heart rate, and the main mechanism of action is it gives deep contractions. By giving deep contractions, so I didn't went very deep with this medication because it's very rarely used, and this medication is one of the last resources, or one of the last medications that we can try in case of patients who are not other medications are not affecting it, not affecting his or not improving his heart failure. So it acts by giving deep contractions, and as we know, by giving deep contractions, we will improve the cardiac output of the patient. And this medication is considered as one of the very toxic medications. And one of the things that we have to put an eye on is potassium levels. If the patients have a potassium level less than 3.5, we have withhold this medication. The last group is group called angiotensin receptor neprilysin inhibitor. So this medication is a combination of medication which is Scubitril and valsartan. Valsartan, as we know, is angiotensin receptor blocker. Scubitril is a medication which acts on neprilysin inhibitor. So what both medication do, they reduce the blood pressure. How they do, we know the action of valsartan because we already discussed that. But for Scubitril, this medication, they block the breakdown of BMP, which is brain and natriuretic peptides, and BMP is responsible for getting rid from sodium and reducing and by getting rid of sodium, we have a diuretic effect. So by doing so, we are reducing the blood pressure more and more. So it has a dual action on reducing blood pressure, and this is the only medication that reduces the myocardial cell death and also improves the ejection fraction. So yeah, this was the last medication that I wanted to discuss about the heart failure. And if you have any suggestions for any topics, just let me know in the comment box. thank you guys. See you in the next videos.